Let's talk sports medicine. Our good friend from Akron Children's Hospital Sports Medicine Center, Dr. Joe Congini, with us on a Wednesday morning. Good morning, Joe.
Hi, Ray. How you doing today?
Doing terrific. How can I not be doing well with this summertime weather we are getting right now?
Really, it looks and feels so beautiful. Awesome.
Wait, what do you have for us today?
I wanted to look at a few of the angles of the Kevin Pillar issue with getting hit in the face.
Mm-hmm.
I don't know if many people have seen that. If people want to see the video, it is a little bit graphic to see, and some people might not even want to see the video, but it's about a 1-minute video that's kind of gone viral. I actually saw the play live. My son is home. We were watching a little bit of baseball. It seems like the Mets are on every game that they have on national, maybe because of Frankie playing with them. I don't know. But we were watching the game live, and when Kevin Pillar, who's a player for the Mets, got hit in the face with a 94.5-mile-an-hour fastball, it hit him just below the helmet and right directly in the nose. And as the trainers worked on him and worked over him, there just was a steady stream of blood coming from his nose. And when you finally did see him, it was pretty gruesome to see how his nose looked. You could tell, obviously, fractured through the TV. He had black eyes. He was interviewed yesterday, so he is doing a little bit better. But it brought up a couple of points. So 3 angles of it I wanted to look at, Ray. Number one, for the baseball angle, there's been a lot of discussion about why there's more hit-by-pitch batters at almost every level, particularly everything always starts with the pros in Major League Baseball, but more hit-by-pitch in the last 5 years. And I guess some of the discussion centers around, number one, every one of the pitchers nowadays are all looking for increased velocity. The young people call it velo, and every pitcher who's coming up, velo is the big key. The velo is the way to make it to the levels of college and beyond, and even professional and the major leagues, is how much velocity do you have. And as they're throwing with velocity, maybe not as much command of the strike zone, but trying to crank up the velocity. This is difficult for us on the arm side, too. That's part of why we have so many blown-out elbows and shoulders. But velocity is part of it, and not as much control. Batters maybe are a little bit closer to the plate, so they're going to be able to protect that outside corner with this velocity. And the point of the matter is there are more hit-by-pitches, and I don't think anybody's trying to do as much head hunting in this deal, but it's just loss of control. And I am concerned about the facial injuries. I have had 2 this year in high school locally here where we've had to deal with some nasal fractures. And we'll talk a little bit more about now, number 2, the medical part of it. So on the medical part of it, there are a few changes. We used to, for years and years, we'd see these people in emergency rooms and everybody would start with an X-ray. X-rays were notoriously not very helpful. The nasal bones have a lot of cartilage in them. We really couldn't see much with a plain X-ray. The emergency room doctors in the last 3 to 5 years have gone almost exclusively to doing CAT scans, and they do a limited study CAT scan where they can really see the amount of damage. One of the things I have talked with you about for years is if there's bleeding in the septum, and that is the wall that's between the 2 nasal passages, there's bleeding there. One of the things they want to do is get that blood out the first night, because that can lead to really significant problems later, and then ultimately with the CAT scan decide whether there's going to need to be surgery or not on the nasal fractures. Remember, please, everybody, is check for concussion, because a certain percentage, a fairly high percentage, that get hit in the head with a baseball may have a nasal fracture, but they may also have a concussion. And on the third part is the equipment part I wanted to touch on today, Ray. And so equipment changes. I was a little surprised to research this in the last 24 hours. There still is not a requirement in youth baseball, high school baseball, college, or the pros that anybody wear any facial protection. However, you see that more people are wearing facial protection, particularly, again, everybody watches the MLB. I couldn't find a definitive percentage, but almost every game you see there, they said there's about 2 or 3 players who play with what is called the C-flap. And the C-flap is the hard plastic piece in front of the cheekbone on the side facing the pitcher, which would protect the face, the cheekbone, and the eye socket, as well as the nasal bones. And so a lot of people wearing C-flaps. Do you know how that's not a very new thing? Do you know the first time somebody wore a C-flap? Ray, I'm going to go to history because you and I are historians. 1988, a guy by the name of Terry Steinbach. Do you remember Terry Steinbach?
I do. Catcher with the Oakland A's, yeah.
Yeah, Steinbach wore one in 88. So C-flaps are out there. They don't let you put on a C-flap or anything of your own. It has to. The helmet has to come with it made on it. Rawlings makes one now. They're trying to kind of get it marketed as the R-flap, but something in front of the face. And I'm thinking that hopefully, maybe as a part of what happened here with Kevin Pillar and others, this will get people thinking more about facial protection and maybe even thinking again about requiring it. I don't know, not being a high-level baseball player, how much on the other end it is restrictive or for the vision and stuff like that. But, gosh, after you watch some of these, if you saw that, it really was pretty gruesome to see Kevin Pillar being hit and other people this year being hit in the face. And so I hope that we kind of revisit the C-flap or some sort of protection, perhaps with equipment by the end of the season.
Yeah, Joe, I've often wondered that for years, you know, with me coaching a number of years with the teens and such and seeing some of these injuries in the facial area. And I've often thought with all of our technology, you would think we would come up with some sort of clear plexiglass or plastic that you could put on the helmet, and also for the pitchers, if there was some way to do there. I know you're concerned. We should be concerned about restricting these athletes, but also those baseballs are coming off there now. High velocity off those baseball bats, and they're being thrown. Pitchers are throwing routinely now in the mid-90s. It's rather dangerous both for the thrower and the batter.
You're exactly right. And I did read a little bit on both ends, and even some fielders. They talked about the third baseman, first baseman, other. And I don't know, I guess just restrictive with the plastic because people have tried this and it just didn't go anywhere. And so but definitely with the batters, I hope this heightens the awareness for people, and that's kind of one of the reasons why I wanted to bring it up. You know, 17% of baseball injuries are people getting plunked or hit by a baseball. Many of them are pitched baseball. And so from that standpoint, maybe this would be something that would bring it to a head, and maybe there would be more people thinking in this way. But thanks for your perspective as a coach, Ray. I know you've been watching this for a while, and sure would be nice to kind of continue to make the game safer.
I agree with you 100%. Joe, thank you for the visit, my friend. We'll catch back up with you next week.
Okay, enjoy this beautiful week and weekend, Ray.
You know I will.